What is this new concept? Why are people talking about this percentage weight loss nowadays? What is your clinical experience? So do you have people who come to your center who are actually able to do the same? They are able to lose weight and remit, or is it something that is very temporarily achieved? And at what level do you suggest medicines for losing weight, and at what level do you say it's only lifestyle is good enough? Dr. Lakshmi, nowadays, whenever you go to an endocrinologist or a physician, they're all saying percentage weight loss, percentage weight loss. It was never heard before. When we used to go to a doctor around like 3-4 years back, nobody used to discuss about percentages of weight loss. What is this new concept? Why are people talking about this percentage weight loss nowadays?
So we have the landmark direct trial which came out, and in this was a very good study. So it showed that the more the percentage of weight loss, so if somebody has obesity, somebody is overweight and has diabetes, the more percentage of weight loss that you help the patient do, the better the chance of remission of diabetes. So in layman terms, they say that reversal of diabetes, but the correct word is actually remission. But both means the same. That if you actually lose a certain percentage of your body weight, you can actually have remission of diabetes. So earlier we used to think that diabetes is a lifelong disease, and if somebody type 2 diabetes, now we are talking about type 2 diabetes. Of course, type 1 diabetes, if you are diagnosed with type 1 diabetes, then you need to be on insulin, and insulin is the only therapy for type 1 diabetes. But when we speak of type 2 diabetes, we have certain clusters in type 2 diabetes as well, and the most common cluster that we see is somebody who has a family history of diabetes, is also overweight and has diabetes, especially the younger individuals with diabetes. So if they lose say 10 to 15% of their body weight, they can actually stop their medicines for diabetes. So not only about diabetes, so when we have obesity, we have diabetes associated with obesity, we have osteoarthritis associated with obesity. So many people keep suffering from knee pain, they're not able to walk, they take painkillers for knee pain, they go for total knee replacements for knee pain. But what is causing this knee pain is obesity. It's because the weight is excess, your knees are not able to bear that weight, and that's why the knees are paining. So that is also related to obesity. Then there's obstructive sleep apnea, a lot of snoring at night, which is linked to obesity, and that can cause hypertension and lot of other things as well. So the root cause of all of this is obesity. And when you speak of percentage weight loss, if you have 5% weight loss, your hypertension gets better. Suppose you need 4 medicines to control your BP, that will go down to 2 medicines. If you have 10% weight loss, you might even stop your medicines for hypertension. You might even stop your medicines for diabetes if you have say 10 to 15% of weight loss. So that is why I think now we are slowly realizing that treating each of these conditions is not actually treating the problem, and treating obesity is treating the root cause of all of these conditions, and that's why we are talking in terms of percentage weight loss.
Yes. So that's well said. Around 3 years to 4 years back, even I must admit, then when a person used to come to a clinic with newly diagnosed diabetes, we used to say, why don't you do some exercise, go meet the dietitian and she'll explain to you about the diet, and take the medicines on time. I think even our perspective has changed now. With the person who comes with newly diagnosed diabetes, we are directly talking to them about weight loss, helping them to achieve remission of diabetes, rather than just giving generic statements like, why don't you lose some weight, like that. So what is your clinical experience? So do you have people who come to your center who are actually able to do the same? They are able to lose weight and remit, or is it something that is very temporarily achieved?
No, so this is something that I'm passionate about, helping people, especially younger individuals who have been diagnosed with diabetes, maintain their glucose control without medicines. So because when we talk about remission, your chances of remission is highest, we know, is in the first 5 to 6 years after diagnosis. So somebody who is newly diagnosed with diabetes and also has obesity, if they are guided in the right way about what diet. So many people have this misconception that when they speak about diets, we have to not eat at all, or they're very low calorie diets. It's not actually like that. So we have come up with a protein rich diet which will actually help the patient keep full, have 3 meals a day, but still lose weight. So when we talk about this, we have to stress on the quality of the food, and also portion control is important, but one need not starve to achieve diabetes remission, and just have to eat right with the right kind of advice. I think many patients have been able to have their diabetes in remission, and that I think as endocrinologists also, that is very fulfilling to help somebody achieve remission of diabetes.
And at what level do you suggest medicines for losing weight, and at what level do you say it's only lifestyle is good enough?
So all patients are different. You'll agree with me that somebody who is very busy, has no time to make any sort of dietary changes, and has diabetes, osteoarthritis, and all of these complications associated with obesity. I think if they are not able to make any lifestyle changes that will help them even lose 5% of their body weight, then medicines are good for them. But lifestyle change, lifestyle modification is the pillar stone for everybody. Everybody has to make lifestyle changes, but if lifestyle change alone cannot help you achieve 5% of your body weight loss, then you can take the help of medicines. But like I said, with the right kind of advice for the diet, it's actually quite easy to follow and achieve that weight loss even without taking the help of medicines.
I think then the take-home point should be, if you're newly diagnosed with diabetes, don't lose hope. There is the new hope that if you lose a certain percentage of your body weight, you can even achieve remission of diabetes. But of course, don't fall for social media gimmicks and just follow anyone blindly. Please meet a qualified endocrinologist who's closest to your place, who deals with diabetes remission. I think. Thank you.